Assalamu alaikum. My name is Dr. Chandra Pandit. I am a specialist in internal medicine at the Al-Sharq Hospital, Fujairah. I will be putting across a few points on diabetes, how to manage and prevent diabetes. As we all know that there are two types of diabetes. One is the type 1 diabetes, which is usually seen in children. This is an autoimmune disease where there isn't enough insulin produced by the pancreas, and therefore insulin has to be substituted in the body. Type 2 diabetes is what we generally see, which is a common type of diabetes, which is usually seen in adults. It was traditionally seen in adults, but now we find a lot of young children also coming up, being diagnosed with type 2 diabetes because of unhealthy eating habits and obesity. As we know, the prevalence of diabetes is rising in the UAE. At present, UAE ranks number 16 worldwide in diabetes, in type 2 diabetes, and about 19% of the population has diabetes. I would like to talk about another term, which is pre-diabetes. Pre-diabetes is when your blood sugar level is higher than normal, but still not high enough to be labeled as type 2 diabetes. This is where most of the interventions for diabetes, such as lifestyle management, obesity control, comes in. As we all know that diabetes is highly prevalent in the UAE. About 19% of the population has type 2 diabetes, and UAE ranks 16th worldwide in the prevalence of diabetes. So it is high time that we thought about preventing diabetes. How can we detect type 2 diabetes? If there's a strong family history of diabetes, or both parents have diabetes, there is a 50% chance that children can have diabetes. There's a family history of a brother or sister, any sibling with diabetes mellitus, then all other family members must get their diabetes detection done early. How can one detect diabetes? Anyone who should go to the doctor and seek advice regarding diabetes? Any person above the age of 45 who is obese must get a regular blood sugar level checked every 6 months. And any person who is below the age of 45 with 1 or 2 additional risk factors for diabetes, such as obesity, family history of diabetes, must also get their blood sugar checked at regular intervals. Pre-diabetes may or may not produce any symptoms. Therefore, it's best to get a regular blood sugar checked and detect it early. Some of the common symptoms that patients may complain of before being detected to have type 2 diabetes are increased urination, increased thirst, increased hunger, unexplained weight loss, non-healing wound anywhere in the body. So in case if there is a strong family history and one suspects that he or she could be having type 2 diabetes, he must see the doctor immediately, where the doctor will get a few simple lab tests which can pinpoint whether the patient has type 2 diabetes or not. When somebody is told for the first time that he or she has type 2 diabetes, most of them are usually in a state of denial. They come up with, oh doctor, but I'm doing everything right. Why should I have type 2 diabetes? Maybe it was something I ate last night, or I partied hard last week, and maybe that is why my blood sugar is high. When an endocrinologist or your physician tells you that your blood sugar is high and that you have type 2 diabetes, he or she is pretty much sure that this is where intervention for type 2 diabetes comes in. You may get a grace period of 3 months where the doctor would like to try out lifestyle changes, which is reduction in weight gain in case you're obese, change in diet, cutting out all sugar, all refined carbohydrates, in your diet and then getting another blood sugar checked at say 2 months or 3 months interval and your 3-month average, blood sugar average, and if that is acceptable by your doctor, then he or she will tell you that you need not go on medication and you can continue to maintain a healthy lifestyle and control your blood sugar. But most of the time it has been observed that people are very happy to pop in 1 pill or 2 pills and eat and drink as they please and hope that the pill will take care of the diabetes. A doctor cannot help you control your sugar unless you help yourself. So the first step in prevention or in managing your blood sugar level would be a healthy lifestyle. Follow the diet sheet as chalked out by your dietitian or your doctor about what food you must avoid in case of diabetes, and maintain a healthy lifestyle by walking about 30 minutes every day. Moderate walking, 30 minutes of any moderate intensity exercise is adequate for 5 days a week. Aerobic exercises and resistance training is known to help. Limit alcohol intake, limit the intake of processed food, and the whole family must get into a healthy eating habit, because it has been noticed that when parents live an unhealthy lifestyle, the children also can develop diabetes. As a last resort, if your blood sugar continues to remain out of control, the doctor might step up the dose of your anti-diabetics and might finally add insulin to help control your blood sugar. In fact, patients who take insulin right from the beginning, right from the time type 2 diabetes has been detected, are known to have fewer complications as compared to those whose blood sugar is uncontrolled on oral medication. In conclusion, diabetes is a lifestyle disease. Type 2 diabetes is a lifestyle disease, and maintaining a healthy lifestyle can help control your blood sugar to a certain extent. Your doctor cannot work magic and just help control your sugar with medication and insulin, in spite of what you do outside the doctor's office. So let us all come together and maintain a healthy lifestyle and prevent diabetes mellitus. Thank you.
أنا دكتور وجدي كمال من مستشفى الشرق بالفجيرة. النهارده عايز ألفت نظر السادة المشاهدين إلى السكر المنتشر في منطقة الخليج بطريقة عنيفة. مرض السكر بيبقى مرتبط دايما بزيادة الوزن وقلة الحركة، خصوصا النوع الثاني، بينما النوع الأول بيأتي للصغار السن، وده بيكون نتيجة فشل في وظائف البنكرياس. احنا عايزين نحاول نتفادى مرض السكر. مرض السكر ده ممكن نتفاداه عن طريق اتباع التعليمات اللي هقول لكم عليها. أول شيء هو زيادة في الحركة والنشاط البدني. بنصح السادة المشاهدين ان هم يقضوا اكتر من ساعة في التمرينات الرياضية او في السير على الاقدام، ويمارسوا ده بصفة منتظمة. نحاول نقلل الوزن عن طريق اتباع العادات الغذائية المفيدة، زي إقلال السكريات وإقلال السعرات الحرارية بصفة عامة. دايما نلاحظ أن مرض السكر مرتبط بالسمنة، وكيف نتفادى السمنة؟ نحن نتفادى الأطعمة اللي فيها سعرات حرارية عالية، زي اللي فيها زيوت وفيها سكريات كتير، وهكذا نستطيع أن نتفادى مرض السكر بصفة عامة. أنا بتمنى لكافة السادة المشاهدين صحة جيدة ودوام الصحة، وشكرا.
Hi, I'm Osman, marketing specialist of Al Sharq Hospital, Fujairah. Today, November 14, we are conducting a free diabetic awareness campaign for a week in connection with World Diabetic Day. During the campaign, we have come up with a special diabetic profile package, which is absolutely least and affordable for the diabetic patients in order to complete their diabetic treatment from the hospital. Thank you.